Hi guys, welcome back to my channel. This is Inday RN, your nurse in charge. And on this video, we are going to talk about the community health nursing, specifically the epidemiology and the level of prevention. But first, please don't forget to click like, comment, and subscribe on my channel, especially if you are new. So, let's start after the intro. In community health nursing, we need to discuss the epidemiology. And did you know that epidemiology is actually three Greek words? First is epi. This means on, upon, befall, take place. And here, always think of the epidermis, which is upon the body. The next word is demo. That means people. And here in demo, think about the demographics, which is the study of statistics of population, people. And the last word is ology, which means the study of something. Here in epidemiology, it is actually a branch of medical science that investigates all factors that determine the presence or absence of disease and disorders. And it is simply means that this branch of science is the study of spread, transmission, incidences of disease within a population. So in epidemiology, it is three Greek words, epi, demo, ology. That is literally defined the study of that which befall people. And here in epidemiology, it simply means the study of spread, transmission, and incidences of disease within a population. Since we are speaking about people, we are actually talking about the population. What is really happening? So we can see what is really happening in a certain population. Okay? In epidemiology, we actually really need to discuss the epidemiology triangle, wherein this is a model that scientists have developed for studying the health problems within the community or within the population of people. And here in the triangle, there are three corners, which we call the vertices. These are the host, the agent, and the environment. Here in the host, these are actually the organisms harboring the disease, okay? So here, they are usually humans or animals which are exposed to and harbor a disease. Let's take note that host can be the organism that gets sick as well as any animal carrier. That includes the insects and worms that may or may not get sick. Always remember, here in the host, it can be a human or an animal. That's why this is the who. Meanwhile, here in the environment, these are the external factors that cause or allow disease transmission. Okay? And the environment is the favorable surroundings and conditions external to the host that cause or allow the disease to be transmitted. So always remember, here in the environment, these are the external factors and it could be social or physical. What do we mean by social or physical? Here in the physical, it could be the water, the food supply, and the geography where people are staying. Meanwhile, in the social, it can be the access of healthcare, the work condition, and the poverty. Meanwhile, here in the agent, these are the factors that cause the disease. This could be the bacteria, virus, fungi, and protozoa. So once these three are available, the host, the agent, and the environment, there is a possibility in the development of a disease. That's why the mission of the epidemiologist is to break at least one of the sides of the triangle. So, disrupting the connection between the environment and the host, and of course, the host to the agent or agent to the environment. Once the chain is break, there is a stop of having disease, or the development of a disease will be stopped. Meanwhile, we also need to discuss the incidence and prevalence. What's actually the difference between them? Here in the incidence, it is actually the number of new cases of a disease or disorder in a population in a specified amount of time. Always remember the word new cases of a disease. New, okay? New, incident. So for example of an incidence is that in December 2019, there were incidences of COVID-19. We are actually speaking about the new cases of a certain disease. And the incidence of COVID-19 happened in December 2019. Okay? Meanwhile, here in the prevalence, this is the number of existing cases of disease in a population at a given time. Here in the prevalence, we are already counting the number of existing cases. That means this is the continuation of the incidence. Okay? The new and pre-existing cases. Always remember that. The time that the COVID-19 started, that is the time that happened, or that's what we call the incidence. Meanwhile, here in the prevalence, it is actually the number of existing cases. That means that we are counting the number of cases or COVID-19 up until today, because today is the given time. Okay? Now, let's proceed in the level of prevention. Part of community nursing is to know the level of prevention, because we need this one as a guide in order for us to have a good management in our community. Here in the level of prevention, we actually have three. That is the primary, the secondary, and the tertiary. Here in the primary, we are actually talking about the prevention of the initial occurrence of disease. Or this is an intervention that prevents the disease process from ever beginning. That's why we are speaking about prevention, okay? Because we are looking for things or management in order for us to prevent a certain disease to happen, okay? One of the example of this is giving vaccine to our clients. Number 2 is secondary. Secondary level of prevention means that this is already the early detection of disease to limit the severity of disease. Or this could be the interventions that identifies and stop the disease early in the disease process before a patient will realize that there is something wrong. Okay? So in this secondary, we are actually doing some screening tests to our patient. And this could be testicular exams, mammograms, PSA testing. Let's think that here in the secondary, there are activities to see if there is already a presence of disease. So we need to catch early as soon as possible in order for us to prevent the severity of a certain illness. Meanwhile, here in the tertiary level of prevention, we can no longer prevent the presence of illness, but rather, we need to maximize the recovery after an injury. That means that we are doing some treatments already here. This could be rehabilitation treatment or rehabilitation therapy, occupational or support group. Here in the tertiary level of prevention, the disease is already present, but we are doing our maximum care in order for us to help our client. Here in the tertiary prevention, this is actually the interventions that are being used for patients who are actually having clinical symptoms of that disease. And these interventions may attempt to cure a patient, decrease morbidity, decrease mortality, or the functionality of a patient. Okay? So remember, P, primary prevention. Okay? So P, primary prevention. S, secondary screening. And T, tertiary treatment. Another example of this one is a patient with diabetes. So here in the primary prevention, that patient will get a current updates on how to have a healthy diet and exercise plan to prevent the occurrence of diabetes mellitus that will occur in the future. So maybe here in the prevention, there are some health educations being done by our community health nurse in order for our people to prevent a certain disease. Okay? Meanwhile, here in the secondary is that we are talking about screening. So our clients will do blood glucose screening in order for them to identify diabetes on its early stage so that we can prevent the complications. Okay? Meanwhile, here in the tertiary prevention, we are already using medications to treat previously diagnosed diabetes in hopes of decreasing the onset or severity of symptoms, which could be lead into a difficult complications like HHNS. Okay? So I hope you guys gained knowledge in this topic. And if you do so, please don't forget to subscribe on my channel and share this video to your team. If you need some help in nursing examinations, you can check the other videos that I have on this channel. And of course, don't forget to give me a thumbs up and hit that notification bell. If you guys need some help again in nursing topics, or if you have some difficulties in nursing, you can comment your problem down below and maybe I can help you. So thank you so much guys for watching. Don't forget to give me a thumbs up and share this video to your friends. See you on my next video. Bye!